In a couple of days, World Heart Day is taking place. It's a day to raise awareness about cardiovascular diseases and also promote heart health. With us this morning to talk about it all and how you can make sure your heart is beating strong and healthy is Dr. Spitz. He is a cardiologist with Inova Health System in Virginia and doing preventive cardiology care along with the director of advanced lipid programs. So Dr. Spitz, thanks so much for joining us this morning. We appreciate it.
Thanks so much for having me here.
You're welcome. So heart disease is one of the main causes of deaths for people across the world. Do you find it to be more common in men or women? And if so, what are the primary causes of heart disease?
Absolutely. And sadly, it's common in both men and women, but unfortunately, it's underdiagnosed and undertreated in women. So we see a lot of complications in women, much more so than we necessarily need to. Unfortunately, we see 20 million deaths across the world from this, and about 80% of premature cardiovascular deaths are preventable. So the major causes are things that the American Heart Association has us look at, which we call life's essential 8. So staying physically active, or in this case being sedentary, is a big risk factor for heart disease. Poor diet, so making sure that we have a very heart healthy diet. And then the big risk factors that I'm always looking for in clinic: high cholesterol, high blood pressure, diabetes, and smoking. So trying to control all of those are really important to understanding both your heart risk and how we can prevent heart disease.
And you talk about staying active and being healthy, eating healthy. Is it possible for someone who is doing those things to still be at risk, and by that being genetic health issues playing a role in that?
Absolutely. And it's one of the underappreciated aspects of cardiovascular disease. And it's actually one of the things I see most in clinic is people with genetic issues. Most of the time, a lot of our risk factors are to some degree genetically determined. And there are people, no matter how healthy they are, still are going to have high cholesterol, high blood pressure, diabetes, and risk for heart disease. So I always tell patients that sometimes genetics is going to light a fire. Let's not add fuel to that fire by making sure we stay physically active and eating a heart healthy diet. But it's important to know those risk factors, know your family history, and take care of a heart healthy lifestyle. And talking to your doctor about ways to do that is by far the best advice I have for everyone.
And really quick, for any women who are watching this morning, I mean, we have a lot of viewers who may be moms or may be thinking about pregnancy. Are there any conditions like preeclampsia that might impact their future heart health that they should know about?
That's such an important question, and something that unfortunately until recently was not talked about as much as it needs to be. Preeclampsia, so high blood pressure during pregnancy, gestational diabetes or diabetes during pregnancy, are risk factors for both future high blood pressure and diabetes, but also future heart disease such as heart attacks and strokes. And so women with a history of preeclampsia, gestational diabetes, or other heart-related pregnancy complications absolutely need to talk to a doctor or see a cardiologist comfortable in taking care of women with these conditions so that they can be appropriately screened for other risk factors, treated for those risk factors, counseled about future pregnancy, and understand their future heart disease risks so that we can avoid those complications down the road.
All right, some good tips, Dr. Spitz. We appreciate it. Thank you so much ahead of World Heart Day.
Anytime. Thank you.
Thank you.